One of the questions we get asked, again, multiple times per day here is what is the ideal candidate for vertebral body tethering? The data is starting to come out and shows us that a patient who has significant growth remaining with a curve somewhere between about 40 to 60 degrees, a very flexible spine, those are the patients who are going to do best with vertebral body tethering. And sometimes they'll even ask me, well, what do you mean by flexible? We've even had candidates from out of state, for example, who send me their x-rays. They've got a curve that would be really good for vertebral body tethering, but the curve is really stiff. The way we discover that is we just do additional x-rays. We do x-rays where the patients try to unbend their curve, and then we can take an x-ray and see just how much that curve is moving. So this particular patient, she had a very stiff spine, so we simply coached her on some exercises that were perhaps allow that spine to become more flexible, see if she could become a vertebral body tethering candidate. And wouldn't you know it, after a few months we repeated the x-rays, the curve was much more flexible and she was able to go through with vertebral body tethering. So there are a lot of different things we need to consider when we're trying to figure out, okay, what's the best surgery for a curve that's just out of control. But really what we need to see is a curve between 40 and 60 degrees, someone who has a lot of growth remaining, and someone with a very flexible curve. Now, there is a subcategory of patients that, to me, I find very interesting as well. And these are patients who are completely done growing. The FDA has approved vertebral body tethering for the use in children who are still growing. There are, however, many people who have an interest in vertebral body tethering who are done growing. They're really attracted by the opportunity to have their scoliosis corrected, but they don't want fusion. They don't want to lose that motion, and they don't want the long-term possibility of adjacent segment degeneration. So we have a very strict way of evaluating patients who are done growing but may still be a candidate for an investigational use of vertebral body tethering. So certainly we would consider those candidates as well. But we have to be very picky so that not only the patient gets what they want, but we're being responsible and helping them get what actually will deliver the product that they're hoping for.